I get tested every 6 months because to me it's important being sexually active to know your status. If I was infected, I wouldn't want to go around spreading it. It's definitely something that I need to know because I don't know. You don't know if you have HIV. You can't feel it. I mean, you get those flu-like symptoms, but not everyone gets those symptoms. You know, you could have it and not know it. I don't feel that there's any anxiety to go and have it done. Just like going to seeing your doctor. It was just not pressured, but taught to me to know your status and to, something to keep up with and to protect yourself. Me and all my friends that hung out, we went together. Thank goodness there was nobody positive, but that's when it started. And then it was every year. Since I got to college, it's been a little bit more active, I would say. So I definitely go every 6 months. When someone asks me if to go bareback, my reply is no glove, no love. You just have to protect yourself and say no. If you don't want to use a condom, then I'm sorry. I'm not willing to have unprotected sex because I don't want the stress factor that comes with, oh, now I have to get tested. What if he was? What if he didn't know? What if? It is easier to prevent than to deal with it once you have it. But dealing with it is not a death sentence anymore. Let's go get tested. Welcome to Florida. Rains every day at 12 o'clock like clockwork. I am negative, I want to stay negative. So I just take precautions and, check yourself before you wreck yourself, I guess, is how I look at it. The process for getting tested for HIV is, it's very easy. You just make an appointment. There's many clinics that you can go to. You go back, wait to be seen, and then the nurse comes in and asks you about 100 personal questions that you probably don't want to answer, but it is key to answer them truthfully. And then, you do the test, whether it be a mouth swab, a finger stick, or a blood draw. I have had friends to say, I'm not getting tested because I don't want to know. It's not just you knowing, it's infection of other people. Spread the word, not the virus. That's what I tell them, Okay, so you're HIV positive. It's not a death sentence anymore. Medications have come a long ways.
Nice to see you coming in. So is there any particular reason why you're coming in today, or just to get screened in general?
No reason. I'm not having any signs of anything. Just in general, it's, my 6 months is up, so It's time to get tested.
Perfect. Were you born in the U.S.? Do you identify as male? And does that say the same thing on your birth certificate? Okay, so the way the OraSure works, it's kind of like a toothbrush, but you put it in between your cheek and your gum, and you brush around. And the point is to get skin cells in this little pad. Go ahead and grab it out. Really brush it around all the way around.
All in my mouth?
Yeah. You don't want to force yourself to bleed or anything. If you do, that's not a big deal, but we don't want you to hurt yourself. So just going to go ahead and dump that in there. Push it in white side first. And you're done.
When you see someone getting tested, it makes me proud when I see friends that go get tested. Like, wow, good job, buddy. Very painless. Nothing to it. That took every bit of 10 minutes once the wait time's over. 10 minutes if that. One way that I have found to make it easier, to ask partners is make it fun, with your partner. Like, hey babe, let's go get tested. To me, it's a need to know information, and I need to know. So it's a simple question asked. There's a lot of misconception about HIV. It's everywhere. Everyone has to deal with it. It's not a gay thing. I wish there was more education on that. In an HIV-filled world, I would just like people to know, Protect yourself, wrap it up. No injection is worth the infection. Get tested, wrap it up.
As testing increases, HIV infection rates decrease. Find a testing site in your area, hivtest.org.